First of all, what's specifically in this health care reform bill, the good, the bad, and the ugly. Number one, we have, this is Congressman John Larson. I'm quoting his top 10 immediate benefits from the bill, okay? He says it prohibits pre-existing conditions, exclusions for children in all new plans. True. So if your kids have a pre-existing condition, they will not be denied anymore. That's a great win, okay? Number two, provide immediate access to insurance for uninsured Americans who are uninsured because of a pre-existing condition through a temporary high-risk pool. Meaning that if you got a pre-existing condition and you're an adult, you at least go in a high-risk pool. Yes, you have to pay more, but at least you'll get some sort of coverage rather than no coverage for the next 4 years before they get to the point in 2014 where they're not allowed to discriminate against anybody with a pre-existing condition. All right, is that a win? Yes. Now, that high-risk pool, my guess is the premiums are going to be through the roof. But nonetheless, at least you can get some sort of coverage. Point number three, prohibiting dropping people from coverage when they get sick in all individual plans. That's a huge win. That's the practice called rescission, where they go, well, you know, we were supposed to cover you and you paid all your bills, but you didn't tell me you had pimples and zits, so I'm not going to cover your cancer, right? And that terrorized us all, because then you don't really know if you have insurance or not. They're getting rid of that, and that starts immediately, so that's great. Point number four, lower seniors' prescription drug prices by beginning to close the donut hole. Now, you remember the donut hole they had in Medicare? Well, I'm going to cover your prescription drugs if they don't cost that much or if they cost a ton, but in the middle, you were left to your own devices. Well, they're beginning to close that donut hole. Now, let me pause here to say, David Frum, who's a conservative, who worked with Bush, was a speechwriter for him, is saying, look, this is a huge loss, this bill is for conservatives. We played it all wrong. We should have negotiated instead of saying, ha, 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 we're going to kill this thing and it's going to be Obama's Waterloo. Because you can't ever undo these things. How are you going to go to the American people and say, no, 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 we're going to reopen up the donut hole so that if you have drugs, senior citizens have drug needs that are in the middle, well, we're not going to cover you. You can't go back. He said, once you give that to people, you can't take it away from them. Well, how are you going to tell people, hey, you know what, your kids with the pre-existing conditions, we're going to go back to the old system where they're not covered anymore? People will rebel. Of course you can't go back. And as you go down this list, these are all the things that they can't undo. Now, he's a conservative. What he's basically admitting to you is these parts of the bill are so good that the American people will never let you undo them. So then why were you against it in the first place? All right, now let me continue. And then I'm going to get to the bad sides of the bill. He says, Representative Larson says accurately, offer tax credits to small businesses to purchase coverage. Yes, small businesses get some tax credits to give more insurance, a good thing. Eliminate lifetime limits and restrict annual limits on benefits in all plans. Again, true. They begin to restrict annual limits in the beginning and ending lifetime limits right away. So meaning, hey, you know what, you got cancer, but hey, it costs over $500,000, so we're going to stop paying in the middle of your coverage because you reached your maximum lifetime limit. So sad day for you, you're on your own from here on out. Well, then you don't have insurance, and this fixes that. All right, now that's another great part of the bill. Okay, these are adding up. It requires plans to cover an enrollee's dependent children until the age 26. So that's another thing that people are very excited about because then, you know, the kids get to stay longer. Remember, at 65, Medicare kicks in anyway. Now you can get at least health insurance for your kids all the way until 26. Again, once people get used to that, David Frum agrees, they're never going to want to give that up. And then require new plans to cover preventive services and immunizations without cost sharing. It's sensible, small part of the plan, but a good part of the plan. We don't charge you to do preventative services so that you don't get sick and it costs us much more down the road. Sensible. Continuing, ensure consumers have access to effective internal and external appeals process to appeal new insurance plan decisions. Now, here's where I begin to get skeptical. So, for example, if they say, hey, you know what, we think you got a pre-existing condition, we're going to deny you. And you say, hey, wait a minute now, you can't do that anymore. They say, okay, fine, we'll pay the penalty. Well, the penalty is apparently about $100 a day. Now, what are they going to do? They're going to do $1 million treatment of your cancer, or are they going to pay $100 a day for how many days? I don't know. See, this is where the regulators are really important. So if you don't have effective regulation, since they're private insurance companies whose job is to make as much money as possible, they're going to look to hose you anyway. So that's where this appeals process is very important. But I'm a little skeptical here that the appeals process is going to work out fine. You think those companies won't find a way to capture that appeals process so that, hey, look at that. Will you look at that? It turns out they went to appeals and the insurance company won, and then you should be denied. I started to get worried. All right, now the last one on Representative Larson's list is require premium rebates to enrollees from insurance with high administrative expenditures and require public disclosure of the percent of premiums applied to overhead costs. Sounds complicated. What it is they say, hey, you know what? You've got to spend at least X amount, 80%, 75% of the money you take in from people paying their premiums to spend it on their health care. The rest you can use for administrative purposes, marketing, and paying your executives and paying your employees, right? So, okay, if they put a reasonable number on that and they enforce it, that could be good. But it's kind of putting a giant bandage on an underlying problem. The underlying problem is we have a for-profit system in healthcare insurance. And if it's for-profit, they're going to look to nickel and dime you on every one of these issues, whether it's the issue of pre-existing conditions, whether it's the appeals process, or whether it's how much they charge you that they get to keep on their own for their executive salaries and for their bonuses. And so that leads to my overall problem with the bill and why I think it's a little bit of a mission accomplished moment where everybody's going crazy over it and they think it's like the greatest thing that ever happened. We finally have health care for everybody. But the reality is we still have the cancer. The cancer is the insurance companies. They're trying to make a profit off of you. And like fire and fire departments that should be the province of the government, like the police, that should not be based on private insurance, so if you get mugged and you didn't have insurance, the cop doesn't give a damn. Healthcare belongs in that category. Not necessarily the whole healthcare system, not necessarily the doctors or the hospitals, but the insurance, so that if you have a problem and you've paid your premium, you should be covered. And what this bill has done is it has put a lot of bandages, and I don't want to diminish them. As I just told you, some of them are great. They're not Band-Aids. They're significant bandages around a lot of these problems. But the cancer remains. And the reality is, tomorrow, if the bill passes, or the day after the bill passes, or the month after or the year after, these guys can and will come back and raise your premiums. So the bill is great for people who don't have health care coverage because it gives subsidies all the way up to $88,000, families making $88,000. Now, those are significant subsidies, and some people that get free coverage all the way up to $29,000. So Medicaid is also expanded. So more people get covered. That is real, that is true, that is effective, okay? But on the other hand, for a majority of Americans, your insurance premiums will go up. And then when they do, they will blame the Democrats, they will blame the reform package, and they will blame the reform process entirely and say, oh, you see that, we shouldn't have had any reform at all. That's what drove your prices up. If the insurance companies are smart, and they are, they should raise your premiums right before the next election. And then go, oh, and the Republicans will say, you see that? The damn Democrats did this reform, and what did it do? It screwed you. And it's their buddies in the insurance companies that get to make that decision. And this bill does not change that. Any part of this bill that goes to contain costs, in my estimation, is going to take at least 10 years to apply. By that time, do you know how high our premiums are going to be? Look, why is Medicare more popular than Medicaid? Think about it. This is really important. Medicare is for senior citizens. Medicaid is for the poor, right? Medicare is more popular because it's for everybody. It doesn't matter if you're rich, you're poor, you're middle class. Everybody gets Medicare. You pay into it, and you get it when you're past 65. Medicaid is not as popular with the general population because it's for poor people. So poor people need it, and it's popular with them. But the middle class and the rich go, what do I care about them? Now, if you set up a bill where the middle class Americans, unfortunately, or a large chunk of the population will say, hey, that's good, I'm glad they're covered and all, but my premium went up. That is a politically disastrous situation you've set up. Because they're going to get angry, they're going to overturn the good work that you've done, because the very next step is the most important step. Because right now, if you declare mission accomplished and say, I pulled that Saddam statue down and that's it, we win, victory in Iraq, right? Because I smell a little Iraq in the air with all the celebration going around. And everybody's saying, oh, this is it. This is the greatest thing that's ever happened, and Obama delivered it for us. If you just do this and you don't do the other half, well, when the stuff hits the fan, and eventually it will with the increased premiums, and that was, remember, the number one problem in my estimation, and a lot of people's estimation, that we can't afford the health care coverage, well, then people are going to say no. Instead of making this bill better, what they're going to look to do, and the Republicans are already telling you they're going to do this, they're going to look to make it worse. Okay? They're going to make less reform, less regulation, more privatized insurance. And you know what? We're giving the private insurance industry 31 million new customers. That's a lot of money in their pocket. They're going to take that money and use it against us. Now, I'll tell you right now, I could be wrong. This is not one of those things where I'm putting the hammer down and saying, oh, it's definitive, there's no question about it. There is definitely a question about it. It might turn out that a lot of the people who are optimistic are right. And they say, hey, look, Social Security and Medicare and all those things were not great in the beginning, and we improved them. And maybe Alan Grayson's right, and we come back around and we improve these things, right? Or maybe I'm right, and the system is different now. These politicians are bought and paid for by corporate America. They're not going to make this better. If anything, over time, they're going to make it worse. And as long as those insurance companies continue to get more and more money, they're going to raise our premiums and charge us more and more money to us that they're charging, okay? And a perfect example of that is what they removed from the bill at the very end. And what was that? Well, remember how they Dianne Feinstein had pushed for this? I don't know if you remember, and Obama was very much in favor of it at the last second, and it sounded too good to be true, and of course it turned out to be the case, where they said, hey, you know what? The government's going to get to decide how much they can increase our premiums. And I thought, well, if that's the case, well, then okay, then we got a conversation, because now I don't love the way that you do that, because it seems like too much of government trying to figure out what the right price should be, and I'm uncomfortable with that. I think that is a little too much government. I would do it in another way. But hey, listen, at least it's something, right, where they would be able to say, hey, you know, Health and Human Services decided that rate increase is too high, right? Guess what happened at the end of the bill? Well, as luck would have it, that's the one thing they had to take out. So in the end, you have no public option. You cannot compete with the drug companies. Their patents are extended to 12 years. You can't import new drugs in, and you can't even negotiate the prices. Health care hospitals, some of the larger hospitals in the country, they feel that they've got a tremendous win, and in fact, the stock market showed that today when their prices went skyrocketing, because they're not going to have Medicare rates applied to them. That's part of what they accomplished by killing the public option. Remember, Obama struck the deal with them to kill the public option, not with the insurance companies. The insurance companies get all these new customers, and we cannot regulate their rates, and we have no other option as to where to go to get that insurance. I am worried. If you're celebrating today, I love you, and I hear you, because the Republicans were such asses, and they wanted this to die so badly, and at least there are some very good things in this bill. I get all of that, but I'm warning you, don't celebrate too hard, because right now, as things are, this part of it is an enormous problem. We have not fixed the underlying problem. And if we don't fix that next, we're in for a world of trouble. And the way the politics are now, you think they're going to come back to this? Well, they're not going to come back to this for a long, long time. They're going to say, check, mission accomplished, let's move on. Until those premiums keep going up, and then we'll see what happens.